Hello, everyone. My name is Anthony Volkar. Welcome again to the Resilient Yolo Workshop Series. This is part 4 of our 4-part series that we've been doing to really focus on what is helping our communities here in Yolo County. We're really excited to be joined today by some fabulous speakers. They're going to be addressing resilience in families. And again, this is 4-part of the series. We did a presentation that kind of introduced the aspects of resilience. We did a presentation on resilience in education, and a workshop on resilience in healthcare. And all of those can be viewed on our YouTube channel. If you search on YouTube, Resilient Yolo, you'll be able to find all those workshops. And I would be remiss if I don't mention an opportunity that's coming up. So we are still hosting the Building a Resilient Yolo Summit that is going to be happening on Thursday, May 12th at the Woodland Community and Senior Center here in Woodland. If you go online right now, you'll have the opportunity to register. This is a free conference opportunity. It does include breakfast and lunch. We are really able to offer this opportunity at no cost to the community through the gracious support of our key partners that you see on the screen, the UC Davis Perinatal Origins of Disparity Center, the POD Center, the Yolo County Office of Education where I work, and Yolo CASA and HUI International. So again, if you haven't registered already, please, we encourage you to do that. And you likely have not seen this slide yet. We did announce some of the workshops that are happening. We're really excited to have a roadmap to the future with the county superintendent and Jesse Salinas, our assessor, clerk, recorder. We also are excited about a presentation with United Way with Dante Early. We also have communicators presenting 2 sessions, one on supporting a resilient workforce and another on LGBT community in Yolo County. So again, we hope that you attend it. We're really excited about the upcoming conference. And again, you'll see some additional panels that should be announced soon as well. So we hope that you join us for those. Now with that, I want to go ahead and introduce our speakers for today. I'm really excited. We have 2 really great champions for families in our community here in Yolo. So first up, I want to introduce Lana Casper. Lana Casper is the program manager of Healthy Families Yolo County. The program is a national accredited home visiting program, which utilizes evidence-based trauma-informed Healthy Families America model. And she joined the home visiting team back in 2012. And since then, the program has grown and expanded multiple times, but now serves 100 families at any given time. And she'll definitely be sharing more about her program. Our other panelist today is Gina Delyden. Gina Delyden is the executive director of Verse 5 Yolo. She's served in that role since 2016. And prior to that, she served for 9 years on the Board of Education and was also serving as a deputy supervisor to Yolo County Supervisor Jim Provenza. Verse 5 was created in Verse 5 YOLO was created in 1998 by the passage of the California Proposition 10 tax on cigarettes, and it supports statewide and local programs for early childhood education and development. And Yolo County is one of 58 local commissions in Yolo County. So if both of you would go ahead, and actually, Lana, if you want to go ahead at first and turn on your camera, I'll pull up just a quick slide for you. But would you start by just sharing what's going on with families that you're working with through the programs that you serve? And welcome, thank you for being here.
Awesome. Happy Friday, everyone. Hard to believe that it's April already, but here we are. I find myself in pandemic time, right? It's a different experience of time. So here at Healthy Families Yolo County, it's really been a tough 2 years. I'm sure there's a lot of people attending this webinar today who've really struggled themselves, but have also been supporting families who've been struggling in different ways that the pandemic has impacted their family. And as Anthony mentioned in the intro, we're currently serving about 100 families in our long-term home visiting program. So we try our best to enroll parents when they're pregnant and serve them up until the baby turns 3 years old, because we're really hoping to support them in those 0 to 3 years and connect them with a community-based preschool such as Head Start, Early Head Start, and really make sure that they have that continuum of support in their community. Another part of our program that we actually are quite busy doing as well is resource and referral services. So we have a group of family resource specialists, and their job primarily is to do the outreach and engagement. So before families are like connected and enrolled in home visiting with us, we're calling all of these parents, and we get these referrals through the CommuniCare Health Clinics, through our work with the R2R Road to Resilience program. We are a part of Welcome Baby, which Gina will be speaking on later. And also just with our network of community partners through the birthing hospitals, the FRCs, from a variety of places. And what the family resource specialists really do is exactly what it sounds like. They're really connecting with these parents individually to find out, what is it that you're struggling with right now? What needs do you have that are going unmet? And how can we connect you to the support services right now? And some of these parents are still, during the pregnancy, and we're trying to wrap these parents in support as early in the pregnancy as possible, because we want to lower those parental stressors. We want to make sure that that parent is housed. We want to make sure that that parent has access to healthcare. We want to make sure that that parent has access to nutritious foods, because that's going to make the pregnancy healthy and then lead to better health outcomes for the baby. So we're currently supporting another 80 families in our resource and referral section of the program. So all in all, that's close to 200 families in Yolo County that our program is supporting right now. And really in these last 2 years, it's been unprecedented. As Anthony mentioned, I've been involved in home visiting, specifically in Yolo County, for 10 years now. And we've never seen families under this much stress, under this much unmet needs. And it's really discouraging because some of the problems that our families are facing are very, very large problems that we can't directly influence. But it's also really hopeful and inspiring to see community providers coming together to pool resources and to work collaboratively to support families in the variety of different areas that they're struggling. And, the influx of a lot of pandemic relief money into the counties, into the states, and really trying to look creatively at how we can utilize those resources to meet unmet needs and to fill in some gaps. And so I think it's probably no surprise that housing is a devastating condition for families in poverty in Yolo County right now. The entire region, honestly. There's a real lack of affordable housing for families. So we are beginning work with parents during pregnancy and right after the birth of their child. And these are families with young children who are living on people's couches, living in their cars. They're living in tents. They're going to shelters. I heard a story just a couple of days ago about one of our clients. She and her children, they're renting the living room of someone else's house because they cannot find affordable housing in Yolo County. Now, to me, I don't know if that really upsets, the people here, but that really upsets me that this is a person who has a job, who is connected to support services, and who is trying to raise children. And her only option at this point is to rent someone else's living room so that she has shelter for her children. And that feels unacceptable to me. And it's not something that we as a program can directly influence right now, because there's just not enough housing to go around for everyone. So that is just at crisis levels for the families that we're serving. These are some of the most vulnerable, poverty impacted families. And we do our best. We are so fortunate as a program to work very closely with the team over at the West Sacramento Family Resource Center. Now, the Family Resource Center has a wide range of support programs, and our colleagues who are also employed by YCCA that work over there are able to help families with so many different things, and not just telling them, go apply over here, but really walking them through the steps. because families that are in crisis, families that are overburdened, families that aren't necessarily very comfortable speaking in English, or maybe don't speak English at all, there are huge barriers for them to apply for support programs such as Medi-Cal, CalFresh. These programs are really critical to supporting these families. And so our colleagues over at the FRC, they directly work with these families one-on-one to help get those applications filled out, to help explain the process, because it can be a little overwhelming. And so we have worked very closely with our team over there in the housing services to try to shelter as many families as we can. And it will continue to be an ongoing need, because a lot of people feel as if the pandemic is mostly over. But for really vulnerable families living in poverty, the cumulative effects of what's happened to them and the cumulative effects of what's happened to our community will continue to impact them the most. You know, there's a buffer for some of us. You know, we're pretty comfortable, we're doing okay, we have access to supports, but families living in poverty, they're the first ones to feel the effects of things like lack of affordable housing, impacts in the job market, and they're kind of the last to recover. You know, they don't have savings accounts. You know, they don't have an extended group necessarily of family and friends who can step in to provide emergency childcare. So sometimes they end up losing their job because the schools closed down, or they can't find a childcare provider, or the car broke down and they don't have money to fix their car, so they can't go to work. And so it's this snowball, this ripple effect. And so we're really trying to intervene as quickly as possible to prevent that chain of unfortunate events from really causing so much stress to these parents, so that they can really focus on being the best parent that they can be for their child. And we're really seeing in our clients, we are seeing what that cumulative loss, that cumulative stress of the last 2 years has done. We have very high rates of anxiety, depression in our population. We are seeing an alarming increase in domestic violence and intimate partner violence. And the thing about that makes it so critical is that when there are incidences of violence and abuse in the home, because housing is so impacted, there's nowhere to go. The shelters are full. It's hard to find even a room to rent. So when there is conflict in the home, when there's anxiety and depression, and unfortunately substance use has really increased as a major coping skill during the pandemic. So we're seeing more acute issues in our families than we have in the past. And there's just not a lot of options to escape it because of housing. So unfortunately, we are having some families that are having to move out of the area. They're having to move out of the region because they can't find a place to live here, or their rent just keeps going up and up and up and they can't sustain it. And we have a lot of participants who have been able to go back to work. It's been wonderful. You know, the job market is strong. A lot of places are hiring. That's been great. But what we're seeing too, and I'm not an expert in this area, maybe there's some people in the group who do have some knowledge about this, but we have like a real gap in services for the working poor, which is a lot of the families that we work with. These are families that have full-time jobs or have multiple part-time jobs. And they work basically to afford housing, and then there's no money left for anything else because the cost of living is so high that the paycheck doesn't go far enough. And then when these families are looking to try to get WIC, or they're trying to get CalFresh or Medi-Cal, or even into Head Start, they're just slightly over the income limit. But they are functionally very vulnerable and very struggling, but then they can't access these supports because the cost of living in this area doesn't necessarily meet up with what the poverty line limits are. So that becomes another issue that the family support specialists that work with these families encounter, because we're trying to refer them to these supports within the community. And then we find out, oh, they're just $10 over the limit for this program, or maybe $100 over the limit for this program. And so I think there are gaps in figuring out ways to look at who's serving families in what capacity, what the different eligibility criteria is, which programs have income limits and which programs don't. It becomes a very large case management task. And I feel like there's a lot of room for improvement in helping families navigate the system and overcoming some of those barriers and supporting, the relationships and the ability to have a safe home. Because what that does for a parent is tremendous, knowing that you have a safe home and that you have access to support when you need it. So that's just a kind of a brief overview.
Very wide snapshot, yes.
It is a wide-ranging issue because it's a complex time, and it touches on a lot of different factors of community, for sure.
Thank you. Well, no, thank you for your work, and we'll come back to you, because I think you've laid out the issues well. I think we can even now start to talk through what are some of the solutions that you're seeing too. So thank you for addressing that. Thank you, Lana. I want to go ahead and turn it over and introduce our other panelists, Gina DeLayden from First Five. I think Gina as well has a brief presentation just to share the work that's being done in early childhood right now. Thank you.
Thank you, Anthony. And I really want to thank Lana for opening that window into the lives of children and families right now. I always learn more from listening to Lana, and I really appreciate her. So I am Gina DeLayden, Executive Director, First Five Yolo. And I'd like to talk to you a little bit today about a program that First Five has, along with our implementation partners who are critical to this work. And so I want to recognize, again, Yolo County Children's Alliance and also Community Care Health, even before I begin. And as Anthony told you, First Five Yolo is a local government agency dedicated to the health, safety, and early learning of Yolo County's youngest children and their families. And today I'd just like to talk to you about a program that we call Welcome Baby. It's an American Rescue Plan funded project that was designated as a priority by the Board of Supervisors. And I'd like to talk to you about why that is, given everything you heard from Lana. Anthony, can I have the next slide, please? Okay, so Welcome Baby is a planned as a 3-year project that will reach Medi-Cal and uninsured families throughout Yolo County who give birth over the time period of the project. And Welcome Baby will expand our in-clinic navigation and home visiting initiative, the Child Project Road to Resilience, or R2R that Lana referenced. And it will attach to that existing successful program by adding a nurse and community health worker home visits immediately postpartum. So Welcome Baby supports our families to reduce the toxic stress and adversity created by the pandemic and build resilience starting at birth. Next slide. So of great concern to First Five during the pandemic has been the proven long-term impacts of early childhood adversity on both physical and mental health, on brain development, on school readiness, and the very real risk that our short-term pandemic, short-term is hardly the word to use anymore with the pandemic, but that pandemic impacts will deepen disparities for those who are disproportionately impacted. So as this group likely knows, early experiences have a profound impact on a child's life. And during pregnancy, in the first year of life, children are the most sensitive to experiences and need a healthy environment for optimal brain development. Parents are critical to buffering their children from the impacts of adversity or adverse childhood experiences. But when the parents themselves are stressed, suffering economically, or experiencing crisis, as you heard from Lana, their capacity in this role is compromised. Early childhood exposure to stress has lifelong consequences, learning difficulties in school, physical health problems, and higher probabilities of substance use. So given the stress and maternal mental health issues that we see really nationwide, but also locally, we know that mental health issues were exacerbated by the pandemic, with estimates showing 2 in 3 perinatal women suffer from clinical depression. If I could talk today, the deterioration of maternal mental health does have toxic and enduring impacts on both the mother and the baby. Here locally, we've seen in the data from our partners, particularly CommuniCare Health, that during the pandemic, our families have suffered from increased low birth weight rates, higher risk pregnancies, delays in prenatal care, and a terrible decline in the rates of well child visits and immunizations. Next slide, please. So with Welcome Baby, families will receive 1 nurse visit 1 week after hospital discharge, and then up to 2 community health worker visits. The nurse visit will provide more immediate health screenings, including maternal mental health, and clinical assessment for both mother and baby, immediate triage, lactation support, checks on continuing health care, and will include COVID-19 and other immunizations. The visit should bridge postpartum and newborn care and provides a risk assessment inclusive of ACEs indicators to determine eligibility for further services. In the following weeks, eligible families may receive 1 to 2 home visits from community healthcare workers who are Healthy Families America workers from Yolo County Children's Alliance. And based on their needs and preferences, they'll be triaged into existing services. I also want to highlight that families will receive culturally and linguistically appropriate baby basics, health literacy materials, and other concrete supports that help them with parent education and referrals to community resources, and access to in-depth screening to determine the need for longer-term home visiting. So I am pleased to announce today that Welcome Baby has officially launched. At the beginning of March, the first patients entered the program, and they are eagerly accepting services. In the first 3 weeks, 48 patients were enrolled, and that's about a 70% acceptance rate. For our more vulnerable families, that's a quite incredible statement about the need that families see for themselves at this time. The first nurse home visits have begun as babies are born. And our first hospital, Sutter Davis, is fully onboarded. In fact, Sutter was so excited for these services that they jumped in several days before their go live date. Integration of Elika Health has begun, as well as Northern Valley Indian Health, and we'll be looking to phase Dignity Woodland in soon. Welcome Baby, as I mentioned, is a collaboration between First 5 YOLO and our implementation partners, CommuniCare Health and YCCA. And it is absolutely an honor to work with these agencies as a Welcome Baby team. You see on the right side of the slide, the expected program impacts that will improve both maternal and child health and hopefully build resiliency in the population. So with that, Anthony, I am going to stop and allow you to get to questions and interaction with our audience.
Great, thank you. But I think before we do that, we should just acknowledge the work. So thank you, Gina, for the work from your team and the team at First 5 YOLO, all the providers, the partners, and the Board of Supervisors. There was a lot of collaboration to get us to that point. You can see that in the work that's been done already. So thank you for doing all that. I guess I would start, I think both of you addressed challenges, and maybe we start with the simple question of what more do we need to do? I know that's a loaded question, but what more can we do?
Do you want me to start, Lana? I'll start very broad, and then I'll let you fill in maybe some detail, Lana. I really, Anthony, you pointed to the incredible collaboration that was required to bring forward a project like Welcome Baby that addresses pandemic impacts. And I think that that is what we need more of, is the closer alignment on priorities and the collaboration of multiple agencies. And in particular, speaking from my standpoint at First Five as a local government agency, I think the coordination among agencies who are potential funders or in some way policymakers or decision makers, we need to identify together how we work to maximize the impact. And then we know that there are incredible high capacity, caring, effective, community-based organizations in Yolo County, of which YCCA is one. And we have all of these sort of tools in our toolbox, but we need to come together on our approach and be very strategic in that respect.
Lana, did you want to add to that, or no? I know I asked a loaded question there. I apologize.
As usual, I agree with Gina 100%, which is why we so appreciate our partnership with First Five Yolo. In the early days of the pandemic, the community-based organizations weren't really being heard very well. Direct service staff, social workers were kind of being left out of the conversations. And we were so incredibly fortunate that First Five Yolo was there for us and organizing and saying, what do you need? How can we get you PPE, right? How can we get you formula? Because the shelves were bare, right? You couldn't even go to the shelves and get diapers and formula. So, First Five Yolo's incredible work in really supporting the community-based organizations has been critical to our pandemic response. And now as we transition from pandemic response to pandemic recovery, it's a longer game, but a lot of the same kind of work is needed to coordinate the community-based organizations. And all of us kind of have our own unique specialty, but really getting us all to work together to make sure that families are not falling through the cracks. There are still gaps in services. There are still gaps in eligibility. And looking at how we can really look at that from a family's perspective, maybe a family that doesn't speak English, or maybe English is their second language, or a family that doesn't have a car. Let's look at it from their perspective of how it is to navigate services and try to get the help that your family needs. Are we making it more accessible for families? Are we eliminating barriers? And I think there's still a lot of work to be done because we do this for a living all day long. We help with case management. We help connecting to different agencies that specialize in different things. And it's hard. It's hard for us, when we speak the language and we do it for a living. So to imagine what it's like from a family's perspective, there's a lot of work to be done. Specifically, if we're putting out a wish list of what we feel that families need to help recover from this, obviously we need to invest in some transitional housing for families, for people parenting young children that's safe. That's not some motel where there's drugs being dealt out of the parking lot. So that's a critical, huge need that needs investment right now, today. Also, there's wait lists for mental health right now. As I spoke of earlier, and as Gina mentioned, the rates of anxiety and depression are incredibly high. Substance use, incredibly high. People are self-medicating, which is gonna have effects. Those effects will start to be seen sooner rather than later. And so when we do connect them, there's waiting lists. There's not enough providers to meet the need, especially for our families that don't speak English. So we need more investment, more workforce development in mental health, people who can serve these families in their language, who know their culture. And one of the things that we're seeing right now, as I spoke to earlier, is just conflict in relationships. Families are living in heavily impacted housing situations where there's multiple generations, different people renting rooms. So there's a lot of conflict. These are not homes where there's peace and love and joy. There's conflict and not a lot of space to go around. So we're really seeing a need for couples counseling and conflict mediation, or classes on how to build relationship skills. Because from my perspective, it's been kind of a long time since that was something that was invested in Yolo County, that was widely available. Like, where people can go and take parenting classes, and, but like, how are we investing in our families? How are we investing in relationships? And the pandemic put people's relationships to a test that we've never seen. And again, as I spoke earlier, there's a cumulative effect, right? People are back to work, kids are back to school, but the damage has been done, and they're living with this damage. And because there haven't been specific interventions to help people build back their relationship or nurture their relationships, repair that damage, now we're starting to see the outcome, which unfortunately is a lot of conflict and intimate partner violence and domestic violence. So those are just a few things that I feel are specific and could really use some creative ideas, and some funding to really implement those quickly to really help the community start to heal.
Well, Lana, as you were talking, the word that I wrote down was tipping point. I don't think you said it that way, but you alluded to there were moments in the pandemic that were tipping points for families, whether it be with their housing or their food. Can you just kind of help share, as you talked about the recovery path, what do we think are the new tipping points? I mean, for me this week, I heard a lot of folks talking about the college funds. And so, removing that burden of college debt for a lot of families was a lifesaver, because they realized in this moment, they had a little bit more money to put towards groceries or food or other things. So what do we see as the new tipping points right now as we're in this post-pandemic recovery path?
Yeah, I'm sure the news about college was great for a lot of people. I don't serve those people. I'm serving people who are trying to figure out how to put gas in their car to get to work. I'm serving people who are trying to figure out where their baby's going to sleep tonight. I'm serving people who can't prepare for the birth of their baby because they have nowhere to call home. The tipping point already happened. We are there. And unfortunately, with the end of the rent relief program on March 31st, the housing issue will continue to get worse unless there are some really strong creative investments soon to keep these families housed. I'm really anticipating that there will have to be some sort of migration of families out of this region, because families simply cannot survive here. That is what I see.
Lana, would you add childcare to that list?
Yes and no. I feel like there are childcare options, but again, it's difficult to navigate because it's a patchwork of eligibility from my perspective. I don't work in childcare. We have a childcare team, and I gladly pass that over to them. They are amazing at what they do. From my perspective, when it comes to trying to connect parents to quality, safe, affordable, consistent childcare, it's a patchwork. And we're trying to figure out, well, do you qualify for this? Oh, well, no. Or do you qualify for this? Nope. You make just a little bit too money. Okay. Do you qualify for this? Nope. It is like a whole navigation issue in and of itself. But the infrastructure is there if families can figure out where to go and have people who can work with them along the way. But sure, there is certainly a need for more affordable and more high quality, consistent, which I know that First 5 Yolo has really had its eyes on and has been trying to help with for years.
Yeah, I think I would add that I think now is the time when we're also concerned that even the existing system has been so stressed in childcare that the options that were available, to the extent that they were available previously, may not be consistently there for families. And everything that you said, Lana, is true. Certainly families who are just outside of eligibility, or who have eligibility and then are outside of eligibility, and then it ebbs and flows. And that's a dangerous place, because that's where you lose families, right, as they fall out of eligibility. And I would just also add that the system itself, the childcare system itself, is so fragile right now, having come, having not through it, but having come partway through the pandemic, that's also a very real risk.
Yeah, and I actually did hear recently that we are starting to lose some childcare providers just because it has been so hard for them to sustain it, and that they can't sustain it anymore. So that's the wrong direction. We need to be adding providers, and children absolutely need that consistency. The parents need that consistency. It's hard to focus on, working to provide for your family when, you don't know that you have someone that you trust to leave your child with. It's incredibly difficult. And we have families that are working in the fields right now, and, they absolutely need that income to survive, and they're having to not go to work because they don't have childcare. So it is yet another barrier that they're trying to overcome.
Oh, with those barriers, what do we think is making our families stronger? I mean, you both talked about the education and the services. I mean, what other steps would help make our family stronger? What would help provide that safety net that's a little wider?
Well, I think definitely like those of us who kind of can take the wide angle lens, looking at where those gaps are, and then trying to creatively fill those gaps with other services, with other funding. But I think the thing that really makes an immediate impact to a family that's struggling is having that caring professional who works with them one-on-one to help them navigate the system. So if they're not eligible for the first thing they try, then we try another resource. So we contact a different community partner. Like, we keep going until the need has been met. We close that circle. And a lot of families, they don't have that. So support services through programs such as mine, where we have our family resource specialists and we have our home visiting providers, and the work that our colleagues do over at the FRCs, like, those are so critical to walk families through the process. Because like I said, it's not easy. In the beginning of the pandemic, we had just hordes of people trying to apply for unemployment. The system kept crashing because so many people were trying to get unemployment. And a lot of our families, they didn't have a computer. They don't speak English. They didn't understand how to fill out these applications, but our staff were able to do it with them. We have a saying here in Healthy Families, do for, do with, cheer on, right? And a lot of these families are so overburdened, who are having mental health challenges. They need someone to do it for them or to do it with them. They're not at the point where we can just give them a flyer and say, go apply for this benefit, it'll help you. Though that's not effective. They need more. So do they know who to go to for help? And having that investment in the family resource centers, having those investments in places like the Yolo Crisis Nursery and in home visiting. So these families have longer term connections. They know who to turn to when the world falls out from underneath them, because it keeps happening, right? It's like the pandemic has shown us that one thing can really flip your world upside down: losing your job, getting into a car accident. Unfortunately, having a baby with special needs can flip your entire world upside down, because then you're navigating Medi-Cal and surgeries and all the other things, trying to apply for a long-term aid and respite. So it's like having those people that families can go to, it is a lifeline, so that we can help them navigate how to get what they need. Oh, I see someone in the chat talked about the schools as well. Absolutely. Yeah. Which was why the pandemic was so devastating, right? Because a lot of families living in poverty, they depend on the schools so much for everything, for food for them, for the dental checks that they do at schools, for the counseling that's offered through schools, for after school care to help with homework, because they're already working 2 jobs and they can't be there to help with homework. And when the schools closed, it was just absolutely devastating that the families were struggling to figure out how to feed their kids, because their kids were home all the time and they had no money. to buy food. So it really just goes to show you how fragile the safety net really is for certain portions of our population.
Yeah, thank you for that comment. If there are other comments, please drop them in the chat. You know, we're getting closer to wrapping up on time here. I guess I would just ask you all, is there kind of a success story? You know, through the pandemic, we have hard moments, but we saw moments of resilience. Is there any moment that kind of stands out for you that you saw your work, you saw your teams working, and you saw success happening?
Oh, we see successes every day, for sure. We still have families that are trying to realize their American dream, you know, going back to school, getting that dream job. During the pandemic, a lot of them couldn't work, so they started their own businesses from home. A lot of them working, you know, they started food businesses and event businesses, and really like resilience. You want to talk about resilience of like people who turned their hobbies and their side hustles into a way to keep a roof over their head. Incredible goals. You know, the goals are still being met. People are still in recovery from substance use, even though it seems like the pandemic has pushed people to use more substances than ever. We have people still living in recovery, still working towards their goals. And that's what keeps us going. That it really is. And each time we get a family into, you know, permanent housing, it feels like a huge win, you know?
Yeah, I would just add, Lana's done a really nice job of putting the color and the heart behind the story. And I want to tell you that the data is also behind those statements, that when effective services are leveraged, it makes a difference. I mean, we're seeing families supported with 30 to 40% greater immunization, well child visit rates than in a similar population without that support. They're over 95%, I don't remember what the current number is right this moment, Lana, are able to avoid the need to enter child welfare services because they have the type of support that we've been talking about. Maternal mental health has been supported. We're seeing a real difference when we bring in effective services. I think that's really the key. And to see the families, or to hear when we, you know, ask for some parent voice in what we're doing, to say, my person, whether it's a home visitor or an in-clinic navigator or someone that has supported them at a family resource center or the crisis nursery or Help Me Grow, those folks all make a real difference in daily support, and they do have real outcomes that we can measure.
Well, Gina, did you have a success story that you wanted to share? I mean, I think Welcome Baby, a huge success story, but you might have another.
Oh, you mean individual? Well, when I just talked about some of those outcomes, many of those come from the Child Project Road to Resilience, which is an intensive home visiting program with different arms, Lana's HFA being one of them, or HFYC now, Lana, and behavioral health home visitors from Communicare as well. So I would say, I mean, any of the programs from First Five's perspective, the programs that we've had out are really, I would call them larger initiatives. They blend together multiple services and multiple providers, but Child Project Road to Resilience, Help Me Grow, which I'm sure this group is very familiar with, and Impact and its related pieces for dual language learners, work with childcare providers, is definitely a success story. I would also add, I think Lana touched on this a little bit, and Anthony, you lived through some of this at YCOE. First Five, Yolo County Office of Education, all of our funded partners and community partners really made such an effort, over the last 2 years and plus, to push out, to distribute essential supplies to families and to childcare providers, and then to step in as needed to support vaccination efforts as COVID vaccine became available. I expect that one day when we see 0 to 5 vaccine, that will happen again. And just being able to get out, particularly in the beginning, the masks and hand sanitizer and diapers that people couldn't find in the store, soap. That was an amazing logistical feat and could not have been done without those partners and all of the storage space and the team at Yolo County Office of Education.
Thank you for that. And I found the numbers. These are from August, 56,000 masks. It's more than that now. 55,000 disposable gloves, 76,000 units of cleaning solution, 100,000 plus diapers. And those numbers have risen since. So with that, I just want to, first off, I think, in calling attention to this issue, we pulled the right folks into this space to have that conversation. But I think today's conversation has just reminded us, you both lead incredible teams and have done incredible work. And, you are models of folks that are out there trying to make our communities more resilient. I guess I would just invite you to do a plug for your own teams of how folks can engage with this work, because they will want to. So maybe we'll start with Gina first.
I haven't spent much time talking about them because we're talking about us, but I do have an incredible, very high capacity professional team at First 5 YOLO. They know so much about the needs and the data and the trends, really. They're able to help pull together and design programs with our partners that are effective. I mean, I would say that at First 5, we try to only run programs that are effective, and those that we're investing in right now certainly are that in all of the evidence that we have. So First 5 does actually welcome any professionals who have an area of expertise in health or child safety or early learning. And I tend to run some advisory groups that we meet, every so often to look at what we're doing and help inform our work forward. And sometimes what we hear, Welcome Baby was in part inspired by some doctors at OBGYNs who were talking to us about what was happening at labor and delivery with families during the pandemic. So voices always matter.
Great, thank you, Gina, and thank you to the team at First 5. Lana, to you, and I will pull up your slide as you're talking too. Again, do you want to acknowledge any of your teams or the work that you're doing?
Oh my goodness. My team probably gets tired of hearing how amazing they are, because they are some of the most inspiring people. Like, I could not have continued to do this work for the last 2 years without their commitment to their community. All of my direct service staff, so the family support specialists that do the home visits and the resource specialists, they are all bilingual, bicultural Spanish speaker, Latinx women who really live the passion of advocating and serving their community, helping families with young children, particularly families that don't speak English, navigate the system so that their children have a chance to grow and thrive. And I noticed in the chat, someone posted, about the inequities, the systemic inequities and racism and, and immigration policies that have been particularly harmful to the Latinx Hispanic community. And we really take that seriously. And that's why we have worked really hard to develop a workforce that is of the community, to serve the community, who speaks their language, who understands the struggle that they face, and who can advocate for them. And our acceptance rate among the Latinx community is incredibly high, because I think that the parents can understand and appreciate that our staff really see them. They really hear them. And they want to help families navigate the difficulties. And so they are incredible. We are hiring again. If anybody is on this webinar, as part of the Welcome Baby expansion, we are adding another position to our home visiting workforce. So the job posting is up on Indeed, Family Support Specialist with Healthy Families Yolo County. So if you know someone who feels called to do this work, to support parents and families in Yolo County, please send them my way. I would appreciate it. YOLOkids.org, Career Opportunities is our website.
Great. I'm glad I was able to give you a minute of time to do that plug in too. And so thank you again to Lana for joining us. And thank you to Jenna Balahai. I know she's listening in, the executive director, and her team as well for all that you do. So thank you, Lana. Now with that, I'm just going to go ahead and close out. So again, this has been a 4-part webinar series. We thank you to all the presenters that were able to join us. I would also like to acknowledge Holly Wong, who's been helping us on the back end with each webinar and also being able to post these so that we can record them and share them with folks that outside of this time that are able to attend. And last with, again, we really do hope that you all join us on May 12th for the in-person Building a Resilient Yolo Summit in Woodland. It's going to be a great conference. You'll see some of the same folks here joining us in person in Woodland, and we hope that you join us for that time. So thank you again for joining us this afternoon, and we look forward to seeing you in May.